Lyn Rowe, the tiny dancer. People don't know that you were a dancer, a ballroom dancer, and you are tiny, so that makes you the tiny dancer. Welcome, Lyn. And welcome back, everybody. Before I get into all this other stuff that I know I want to talk about with you, Fidelity just came out with the retiree health care cost estimate, up $25,000 in just 1 year. We'll get to that. But, and seniors dumping their long-term care insurance just when they need it most, according to Dan Cadlick. I'll ask you about that. But first, you are a CFP.
Yes, sir.
Are you going to argue with me today, a former CFP, a reformed certified financial planner? We were talking about college and paying for college, grandkids paying for college and parents paying for college. And we get egotistically involved in wanting to send our kids to the best schools. And the best schools, of course, are defined by how expensive they are. And I said, it really, for me, out of my 4 kids, it only worked with one of them. And it was the one that was most focused and most directed. And you'd be very interested to know he did not come out a liberal, by the way, which I know you were telling me you came out of college a left-wing lunatic.
Oh, well, we don't want to go there. It's an embarrassing past. What can I say?
With due respect to all left-wing lunatics, because this show is trying to be as nonpartisan as can be. But I said something that I know is going to tick some people off. You know, either don't send your kids to school or send them to school and get them a degree that will actually pan out for something in the future. Otherwise, if you're taking retirement funds, it's a total waste of money.
I totally concur. Education comes in all forms, and frankly, the book learning can oftentimes be overrated. If you have someone who is a young person who is absolutely dedicated and has shown indications that they want to become a physician, or they enjoy math and they really like accounting, or name some fields where they really have shown that
engineering, for example, and software development.
But if most kids are saying, well, I don't really know, then junior college is a great place. I went to a junior college.
That's because exactly I didn't want to go to Washington
and then a state
play football in the rain. Because I was a quarterback, a 5'7" quarterback with little tiny hands.
I didn't.
And it was hard enough to throw the ball. I didn't deflate any balls back then. I should have. If I would have deflated balls, I'd have probably ended up somewhere in Washington. But anyway, it's something that's so important, because we get around to retirement, and if we've spent all of our money putting our kids through school and they're getting some liberal arts degree that they're going to do nothing with, and I have 3 kids that basically have degrees that today they're doing nothing with. And then we have to have this discussion about having enough money to cover post-retirement health care needs, to cover long-term care needs, to make sure you have enough money to retire so you can eat.
How do you fit that
all together? How do you fit it all in?
Do you want your kids to be well educated and your caregivers? Or your grandkids? No, you don't.
They have to quit their, low-paying job to be a caregiver for you. You brought something up a few weeks ago on that subject, and I still have a hard time with it, although I remember you sending me the article, and it had to do with the fact that and help me through this, but if you, in fact, had money to provide for long-term health care.
If you have professional...
That's what I mean, yes.
Professional care.
Well, if you had the money to pay for professional care instead of Aunt Millie.
Yep.
Not that Aunt Millie would do a bad job. It's just, Aunt Millie spent the last 30 years of her life smoking and drinking.
Well, even so, I have a family member who is a retired nurse, and they had professional caregiving when he needed the care. And she said it was one of the best things that she and he ever did with their money, because it opened up their relationship to be able to be partners again during his period of time where he needed the care, rather than her being the primary caregiver.
Yeah, but how does this translate into money?
Big time.
All right,
money.
Because I'm interested, I'm interested in the care. But a lot of people that listen and watch this program are interested in the cash.
Right.
So talk about that, because when you sent me that, it blew me away.
Well, Population Health Management in December of 2014 reported that folks who claimed against long-term care benefits experienced significantly lower health care costs at end of life, including 14% lower total medical costs.
Okay, so that's beyond healthcare. Fidelity just came out, as you know.
So now we're going from the long-term care side to the medical side.
Right.
It's actually impacting.
So let's focus on that,
things.
because that was a headline today.
Yeah, you sent that article.
Fidelity retirees healthcare cost estimates rise to $245,000 for a couple. And this was in Forbes. A couple
and that's
retiring.
Up what percent? There was something like 11% in there or something. It was just outrageous.
Well, yeah, that's the amount that it increased.
Yeah.
Right?
Yeah.
So a couple retiring this year, both age 65, should expect to spend an estimated $245,000 in health care and retirement. And that doesn't include long-term care.
Exactly right.
So what you're saying is you could save a lot of that money.
Oh, yeah. And Ray, in the same article, it goes on to say when dental, vision, copays, and all the out-of-pocket expenses are included, the tally rises to $395,000 nearly.
Holy mackerel.
Yeah. So you just take that and apply, say, that 14% number that the other study is citing. What is that? That's $55,000.
Okay, so let me see if I can baseline this. What you're saying is there's $300 and some odd thousand that you're going to spend on healthcare, dental, vision, all kinds of other stuff.
Copays.
And if you have professional help,
Yep.
like a caregiver,
Yep.
for a long-term care need, you could reduce that number by 14%. And this is according to who?
This is according to long-term care, American Association of Long-Term Care published this. Population Health Management did a study, and they went on to say that it also lowered the pharmacy costs by 13%. So that gets into the $394,000 or $395,000. It lowers inpatient admission costs and 16% lower outpatient visit costs.
So, and I think your point is, folks, why don't you take the money that you would be saving anyway
out of your medical expenses. Yes.
And pay for long-term care today?
Yes.
Am I saying that right? Because you're rattling off $50,000, $100,000 here.
Yes.
So take the $50,000 or $100,000, put it into one of those linked benefit things that you and Pastula talk about all the time, and then all you're doing is moving money from your left pocket to the right pocket. It doesn't cost you anything.
Right. And if you don't have that kind of money to set aside, then let's do it on an annual basis or a monthly basis, because you're going to spend that money anyway.
Okay, well, on that subject, Dan Kedlick wrote an article, and I know you have to fight this all the time. Seniors dump long-term care insurance just when they need it. And I know you've told me stories about people that dumped it,
It's not going to happen
and then
to me.
5 years later wanted to get it, and they couldn't get it, not because they couldn't afford it, but they couldn't qualify for it.
Yeah.
So we want to be careful about that. Lyn Rowe will come back for more of this abuse. All right? That's the abuse that I dole out when I interrupt you and all that stuff. If I didn't know any better, you'd think I was Bill O'Reilly or something. Don't go away. It's the Ray Lucia Show.